Let's talk about the role of ultrasound in managing the abruption of the placenta in pregnancy. And let's define what placenta abruption is. This is defined as a detachment of the placenta from the wall of the uterus before the baby is born. And this is a serious medical complication that can cause either intrauterine and fetal demise. It can cause a miscarriage. So this is something that is supposed to be picked early, diagnosed early, so that at least medical management can start, so that at least we can save the life of the baby. And what are some of the signs and symptoms of placenta abruption? One could be bleeding, two could go to low abdominal pains, or sometimes you just see bleeding without any pain. What causes this? Sometimes you might not know the cause, what in the medical field we call idiopathic, and then the next thing could be maybe trauma, or it could be just injury or a sort of a fall. So the placenta will just detach itself from the wall of the uterus. So what do we do on ultrasound? Once you have these signs, maybe maybe the second trimester or the third trimester, once you have the pain in the lower abdominal region, or sometimes when you have bleeding, you'll go to the hospital to see what the problem is. And once you reach there, they'll advise you to do a scan, an ultrasound scan, just an imaging technique, just to see exactly what is happening. And what exactly do we want to look at? We want to look at the placenta. We just want to make sure that the attachment of the placenta on the wall of the uterus is intact and it has not detached. So we look at the margin where the placenta attaches itself on the wall of the uterus. If there is any bleeding, we want to know where exactly the bleeding is. Is it on the marginal? Is it in the is it central? And actually, we also want to look at how severe is the bleeding. Is it moderate? Is it severe? Or is it just a small bleeding? So these are some of the things that we look at, so that at least when we communicate this information to the team of to the medical team that is looking at you or is attending to you at the clinic, they should be able to know how they are going to manage this condition. So once you have either bleeding or low abdominal pain and you're told to do a scan, kindly go and do it. Or if you have this condition, my prayer is that once we do a scan, you're going to be able to detect it, to diagnose it, and at the end of the day, you're going to be helped. Those who might be in the hospitals and have been admitted, or they have been told they have placenta abruption, we are praying that God is going to touch you, God is going to watch over you. We're praying that all is going to be well, because at the end of the day, our hope and our faith is in God, because we know God has given us this information just to help each one of us, to help improve our life, to help improve the quality of our life of our sisters. And at the end of the day, everything I always say at the end of the day is for the glory and honor of His name. Thank you very much for always tuning in, and have a great day ahead.